And joining us to talk about issues like food deserts, food insecurity, food access is Dr. Lauren Landfried, St. Louis University Health Sciences. You focus on nutrition and dietetics. Food desert, I hear that term used a lot. Is it in the official world of nutrition an official term? Are there criteria for what defines a food desert?
There are. The USDA defines a food desert as in an urban area, a half a mile from a grocery store, up to 20 miles in a rural area, depending on the income level. So it's like a low income, low access. And we're defining supermarkets and large grocery stores as the defining factor for food deserts. But this doesn't really capture the entirety, because we know that if you look at the city of St. Louis, the North City is declared a food desert. But when we look at the access points, there are community gardens, there are other food outlets that are contributing to food access. And so there's a lot of just talk about using the term food desert, and really thinking about more about accessibility and also just the political infrastructure that supports it. And a lot of food justice activists are suggesting food apartheid be the kind of a more appropriate term, because of political structures put in place to prevent access or to allow access for particular areas.
Right, and it's not that there's not food available. And I know Chris Kirchherr in our interview had talked about, yes, you've got convenience stores, gas stations, fast food. You can get 2 sandwiches for $5, right? So it's not that there's not food available. What's the issue from the nutrition dietitian standpoint?
Well, it's definitely lack of healthy food options. There may be some, fruits, vegetables at the or at the convenience store or even the gas station, but it's not going to be the same level of variety. There's also, just thinking about the affordability component as well. Is this produce going to be more expensive at this local store, or are they going to be able to purchase as much as like a larger grocer that can bring in a large amount of produce at one time and aggregate that cost, as opposed to a local convenience store owner that has to purchase a smaller amount, and so that aggregated cost compounds the issue.
Yeah, you've been talking to folks about what they need or why they can't get what they need. So you've had some focus groups, so you're not just sitting in your office. You guys are out talking to folks. What are they telling you? What's the problem?
Yeah, so the City of St. Louis Department of Health received a grant from the CDC to address the social determinants of health, addressing food security. And with that, they partnered with us to have focus groups. And the vast majority of the individuals that participated in the focus groups had lower income, participated in some food like SNAP or WIC, or other food supplement programs. And they brought up the things that we just assume, food access. If they don't have transportation is a huge limiter as far as for the families to take a family of 6 in a bus to a grocery store to get food, and then have to carry it back, and they may have to walk a distance to get to the grocery store.
So you're defining the problem. So now let's fix the problem.
Yeah.
And you've got an effort, and I'm going to read it, the Food and Justice Action Collaborative, because there's multiple issues here. It's not just the lack of a store, it's the lack of transportation, it's lack of time, it's lack of whatever. Solution, and what's this collaborative about?
So the Food and Justice Action Collaborative came through Big Ideas research grant at St. Louis University, and we got funded to increase collaboration with regards to food security efforts. And so this collaboration is really a great opportunity, because it's allowing the different, or different departments and people at SLU to work together collaboratively on these food issues. And just as an example, Gerardo Camilo is in biology, and he looks at bees. And so his research on bees, translates to food, because we know that we need bees to survive. And so being able to touch different entities where nutrition obviously makes sense, public health makes sense, but then to work with people in the School of Law about policy and just that justice component of getting people access to food and healthy food, and how do we navigate the different,
So the work continues, and I
Yes.
appreciate the work, and we hope things improve. And as I always say, fortunately or unfortunately, it's steady work for all of us, but it's an important issue in this entire community. So Dr. Laura Landfried from St. Louis University, thanks again for joining us. Appreciate your time.
Yeah, thank you so much.